Hey, it's me, Jack Sislak, and you're listening to Radical Transparency, the SciSense podcast, where we talk about the latest and greatest in analytics, BI, and data, so you don't have to, but you can if you want. I'm on the phone today with Hamza from GeriMedica, and we're going to be talking about healthcare analytics. Please say hello, Hamza.
Hi, Jack. Thanks for having me.
Awesome. It's great to have you. And we're just going to jump into these questions. So first off, please just tell our listeners a bit about yourself, your background, and what GeriMedica is.
Yeah, sure. Well, my name is Hamza. I'm working for GeriMedica, which as a business developer and also as a SciSense liaison. I have a background in health economics and data modeling. And what GeriMedica does is we create an electronic medical record for the elderly care homes and nursing homes in the Netherlands, so that physicians, doctors, physical therapists, etc., can use our system to record or register the right amount of data regarding their client, all SaaS-based, to provide them the necessary software to keep their focus on treating the patient instead of just working in a software and spending their entire day registering all kinds of useless notes like other systems. Yeah.
All right. Well, so the healthcare industry produces tons of data, right? Where does this data come from, and sort of what are users doing right now or trying to do with it? Like, what's the sort of state of the industry?
Yeah. Well, Jack, so I think tons of data is more or less a bit of an understatement. I read a report from Stanford that said that the healthcare industry was producing exabytes of data, where 1 exabyte is, I think, 1,000 gigabytes, and they were talking about 2,000 exabytes. So that is a lot of data.
Wow.
And I think where doesn't that data come from? If we look at the entire healthcare industry, data is created everywhere. If it's not in the hospital itself, it's right at home, where somebody could wear an Apple Watch or a Fitbit or another smart device that would record healthcare data, similar to your phone, that could track your steps or your calorie intake or your water intake. Healthcare data is gathered everywhere, and if you're looking at hospitals or healthcare institutions, of course they produce data from writing treatment protocols in their software packages, but also a lot of data is stored in all those machines or in photos like X-rays or MRIs. In my opinion, that on the one hand we could really improve the data gathering, but also the data usage, or using that data to improve the way of working or improve the way we give treatment or care to patients or to people in general.
Oh, sure. Yeah, that sounds like definitely the best case scenario for the use of healthcare analytics is to improve quality of care. It's a very human-centric industry, and that's the ultimate goal, right? Is to save some lives, improve some lives.
Yeah, I think so, because in the end, we are all humans, and we can all make mistakes, and we can all forget things. And someone that has 40 years of experience and knowledge is further ahead than somebody that just finished their doctor's degree and just started working out. I think it was IBM that produced or created the AI called Watson.
Yes. Yep.
Where that Watson would scan tons of reports or publications, research, etc., so that as a doctor you could ask Watson or submit a few variables, and then it would scan all those reports and give back the treatments that would have the highest possibility of curing that specific symptom or illness. And I think we're just at the frontier of what's to come, of really using data to analyze how we're doing things and to improve on it. Yeah.
Oh yeah, totally. I remember seeing similar things. I forget if it was Watson or which AI or machine learning system was doing this, where if it looked at scans of various patients and was able to correctly ascertain, I forget, the presence of, I think, a tumor or some kind of malady to a comparable degree to human people who would have experience looking for that sort of stuff. So they're like, yep, this is it. We found it. And that's just,
I know. Yeah, I know what you're talking about. I've read about it. I cannot recall the name of the company, but they would train an AI to read X-ray images up to a point that the AI was better or more accurate than a radiologist in interpreting those images and seeing if there was something like a tumor or something else bothering that patient. So I think, yeah, these are just the first steps of using data and data analytics towards something big. As I mentioned before, using AI and images. Before I worked at GeriMedica, I was working at an insurance company where we also used AI in cooperation with a startup from the UK that could read or they created an AI that could analyze or interpret photos, images of damaged cars, and could easily produce a calculation of what the repair cost would be in just mere seconds at a cost of a few euros or pounds.
Yeah.
Where in the normal way of working, a loss adjuster would have to see the photos, it would write a report, would look, sometimes even have to visit the body shop to really look at the car, which would take hours and also a lot of dollars to just get a loss adjusting report. So I think, in some different markets or segments, they are maybe a little bit further along, but I think the healthcare is catching up quickly.
So it sounds like users in the healthcare space know they need analytics, but they aren't always in possession of the right tools to get the most out of their data. Can you speak to the state of analytics in the healthcare industry a bit and go into a little more detail there?
Yeah, sure. Do you know what I think, Jack? I think that data or data analytics or really getting value out of data is not being used or properly used enough. If you're looking at the Dutch market, we see that data and data analytics is primarily used for people with a finance background, using dashboards or Excel sheets or whatnot to look at finance statements, to look at production parameters. What we've seen and what we now know and what we've validated is that if you look at nurses, if you look at physical therapists, if you look at doctors, if you look at researchers, everybody close to the care process, close to the patient, is acring for data and insights and data analytics. And we see that there isn't at the moment not a tool or a way that is good enough or easy enough to use for them to gain the insights that they're desperately looking for. And that's also what we've noticed when we were validating the need for BI or data analytics within the nursing and the elderly homes, is that because the currently in place applications that they are using are at a steep learning curve or a high barrier of entry that doctors cannot answer the questions that they have. With the help of Sisense, we were able to create easily to interpret dashboards that really benefit doctors and nurses. We have doctors that are designers and that are designing their own dashboards on our entire data set, combining millions of rows and records just to get the answers that they are looking for. And I see that times are changing, so we see changes happening, but I think it's still in its infancy, and that we can really improve a lot on getting the right insights or analytics at the right place within the process.
Yeah, that's really interesting because we think of these people as being such capable healthcare practitioners and the ones we depend on to take care of us. And then, here's this other piece of software that's designed for them, but at the same time not really meeting their needs. So you guys put together something in the middle to help them get what they're looking for more simply.
Exactly, exactly. You have to imagine that a doctor or a nurse, they don't work from 9 to 5. They work from 7 to 7 or from 7 to
Sure.
12. They
Yeah.
work
Weird hours.
long hour shifts. Yeah. So that, and their mindset is all focused on helping the patient, curing the patient,
Yeah.
solving the mysteries. And yeah, I can imagine that you do not have time to scour through all kinds of tables or
Yeah.
pivot tables looking at numbers. No, you want an easy to interpret dashboard that tells a story from A to Z, that at the one look in 5 seconds, you know, okay, this is how I can answer my question. And I think in that area there's a lot to improve on, and I think that's all. That's what we also see as one of the success of what we're doing now is that because we're creating such easy to interpret dashboard, really focused on certain aspects of the process, is that doctors are just logging in every day to just answer the sometimes basic, sometimes complex questions that they have regarding treatment or care or how the entire process is going. And it's I think it's a little bit of a shame that that organizations or hospitals are still seeing BI as something that is for the more of a staff application instead of really putting it to use where the need is the biggest.
Yeah, this was sort of that sort of leads into my next question. So it sounds like what you're saying is that the people who were already using the analytical tools are like you said, all in the finance area, the billing department or whatever, and there weren't
Yeah.
really the frontline medical practitioners actually using it, and so that's sort of the big place to go in and for healthcare analytics to start, like we were talking earlier, save some lives, change some lives, improve quality of care for people.
Exactly, exactly. Yeah.
And so why don't we
So
skip forward a little bit, and we can talk about GeriMedica, and you mentioned your embedded analytics, so part of the software. Why don't you take us through that story, like what made you decide to start doing this, and then what does your solution look like for your users, and then how are they using it, and what wins have you seen? You can just take that however you want.
So Jack, yeah. So when we started out with Sisense and our own product, we really wanted to validate with our end users what was the best way we could leverage the application or and the data towards those end users. Was it just going to be logging into Sisense, giving them a few dashboards, or should we go further than that and also integrate dashboards or several visualizations in our own application? So we started out with some ideas and brainstorming and doing workshops with end users to really get to what they were looking for and what they need in the end. And we came up with a two-way solution. So the real data analytics in the organizations just log into our Sisense application and create dashboards themselves. Use Insight Miner to get all kinds of insights, and use other plugins and functionalities that we put to the test.
Mm-hmm.
Uh, and if you look at the more regular users or end users within organizations like nurses, doctors,
Mm-hmm.
physiotherapists, etc., on the one hand, we've integrated key visualizations and dashboards in our application. So when they open a certain record from a client or
Mm-hmm.
when they go to a ward to see an overview, we've included key visualizations to uh, instantly interpret what's going on in that ward or what's going on with a specific patient. So we do not crowd our application with all kinds of visualizations. We just look at the one or two or three perhaps
Mm-hmm.
that are very crucial to the process and uh, give those back to the end users. And furthermore, we also want to empower the doctors, etc., to also create their own visualizations. And if they have a question like, "How is this treatment beneficial for our client?" or "What is the averages we see comparing treatments, comparing um, the care that's being put in by the different staff members.
Mm-hmm.
If they have a question like that, we also want to empower them to uh, answer those questions themselves with the use of SciSense. So within our application, we've also created a deep link or a link towards the SciSense application, so they can go from the one place where they can see their clients, go to the analytics page, and just create dashboards or visualizations themselves. We've trained a lot of the end users. We created a very nice help environment with a lot of videos to keep them going. And what we've seen is that doctors, when they are facing a question
Mm-hmm.
regarding treatment, regarding wards or whatnot, we see more and more that they go into SciSense, create dashboards, create all kinds of visualizations, sometimes easy and sometimes also very complex to
Interesting.
see if there are like significant variables
Mm-hmm.
within the treatment process that delay the care given or increase um, uh, uh, the caring process so that the clients or the patients, sorry,
Mm-hmm.
improve better over time.
Right.
So we see that by walking a two-way street, so
Mm-hmm.
to say, we get the best of both ends and really empower not only the regular staff members but also the nurses and doctors where we've created
Mm-hmm.
the solution for.
Yeah, that's really interesting. I wanted to sort of explore both those avenues just briefly before we move on with sort of larger topics. So it sounds like you had to do a bunch of sort of conversations in the run up to this and really dig into exactly what they wanted to see ahead of time. And then you also, like you were saying, empowering. That's a word we like a lot around here. You're talking about empowering them to really dig into SciSense and use it to build their own stuff. So can you talk just briefly a little bit more about what those conversations were like from a user testing and a development kind of standpoint?
Yeah, sure. So as mentioned before, we did a lot of workshops with with
Mm-hmm.
with our end users, and the question from our side that was asked the most was, "What are you going to use it for?"
Mm-hmm. Yeah,
And I think
that's a good question.
I think that's a very important question because, in essence, we there's a lot of data being generated or gathered in our application, and a lot of data is then being exposed to the end users to gain insights in.
Right.
And what they do in the beginning, because they come from nothing or a little, and they go to a lot, is that they are just going to create dashboards and visualizations on everything,
Right.
and
Right.
which crowds it, and where you also create dashboards slash visualizations that you create once, you look at it once, and then you think, okay, and then a year goes by and nothing happens.
Right.
So when going to the table and doing the workshops with the end users, they gave a lot of feedback and a lot of ideas, and all we did was ask, what are you going to use it for?
Sure.
Is this a visualization or a dashboard where you would log in every day?
Mm-hmm.
Or does it answer a question that you have or that you face every day or every week?
Yeah.
And by doing that, asking that question, we really drilled down to, I think in the end we had around, I think 400 or 500 different KPIs that were being asked for,
Wow.
and we drilled it down to around, I think 30 or 40 really specific ones, key ones that, well, around like 8 of
Mm-hmm.
those were for doctors and 5 of those were for nurses, etc. So just bringing that down to a smaller number also created a more importance and relevance
Yeah.
of those KPIs. Yeah.
Yeah, that's amazing from just a product development standpoint. Because sometimes, your internal clients or your external customers, whomever, will ask you for what they think they need, and then if you just build it for them, they won't use it as much as they think they would. But if you take the time and really like ask these questions and drill down, you end up with a narrower focus that actually does accomplish something that's really useful to the end user.
Exactly, exactly. So at the beginning, when talking with end users, a few organizations already had some kind of BI tooling in place. And talking about what they had in place, they would say, "Yeah, we already have 600 dashboards." And I was thinking by myself, well, that's a lot. And then I asked some follow-up questions, and they would say, yeah, we created a dashboard, and then someone would look at it, and 2 years later, it will be looked at again, and then they would say, well, the filters is still
Oof.
on 2016. You need to
Ugh.
change it to 2019. Yeah, and that is
Yeah.
something we want to prevent. So yeah, from a commercial point of view, you could say, well, we have 100 dashboards right out of the box, which you can choose from,
Mm-hmm.
and I think, well, that is not the right way to go. I think it's
Right.
quality over quantity.
Absolutely.
It's better to have, for example, 20 key dashboards
Mm-hmm.
than to have 100 of those. So that's what we're aiming for.
Couldn't agree more. And I hope there's some people listening to this right now who are kind of like shaking their heads, being like, "Yep, I've used a product like this, or I'm building this right now. I got to re-examine what I'm doing." Or hopefully there's people who are like, "Yep, no, we're doing the same thing. This is great. We're on the same page here."
I hope so too. Yeah.
Yeah. And just to pivot off that to go the other way, so you're saying not only did you really work with your end users to make sure you were building something that they would actually use, but then you also gave them the ability to dig into, the underlying Sisense system and build stuff that would work for them. So just to maybe talk a little bit more about like how that whole process went. And you said you did a lot of training to empower people, and then also built a nice help zone for them to learn more on their own.
For us, this is not our core business.
Mm-hmm,
Our
mm-hmm.
core business is to create the perfect medical record system a physician or a doctor could or a nurse can use.
Mm-hmm.
So what we didn't want to do is create a BI solution, and that for everything, for every change or for every
Yeah.
wish you want, you have to hire us to create it for you.
Oh yeah.
Yeah, we're not a consulting firm, we're a software developing firm.
Okay.
So we really wanted to empower the users or the organizations themselves to create the dashboards that they need without going by us.
Right.
And to do so, we really needed to think differently. We did not want to create product
Mm-hmm.
or a BI solution. No, we wanted to create a service,
Yeah.
a BI service, and that service contains that we do all the heavy lifting
Mm-hmm.
and create an equal platform for all. And you as an organization or you as an end user can feel empowered to just go to the application and create a dashboard very easily. So in all the heavy lifting is the data modeling in the Elastic Cube to create it as simple and as possible. So we try to avoid the many-to-many relations. We try to combine tables as much as we can to keep an overview. So to make it as simple as possible for a doctor to find what he wants to find. So that is where we started. We also created a few template dashboards with a few very cool visualizations, so that you can just copy the entire dashboard and change it, or copy a few visualizations and to their own dashboard. And besides that, we also, like you mentioned before, we have a nice help environment where, of course, there's documentation, but also a lot of videos. We do monthly or bi-monthly webinars where we do Q&As, where we ask a specific organization to come up with a problem, and we create a dashboard real time online live with an audience, and we're going to create a dashboard together and just
awesome.
show those users how you could use or leverage the fullest potential of Sisense towards answering your question. So we really put a lot of effort and energy into creating that service and all its components, instead of focusing on billable hours.
Yeah. No, it really sounds like, I'm glad we got this on the podcast. I want to just get this recorded, that like this just sounds like best practices for how to really, whatever your product is, really serve your end users, and like we, again, to use that word, empower them to get the most out of it on their own.
That's our main focus. Yeah, and for your listeners, I was present at the Sisense Connect event in London last year. I think it was in November.
Cool.
I also did a presentation on how we set up our service. I think it was recorded and also transformed into a blog post. So if your if your listeners are interested, I think it's on the Sisense website on the blogs that you can find the video and the blog post. containing the steps that we've took to get where we are today.
Awesome. All right, so we went a little micro there. Now let's go macro again. Let's talk about some major trends you see in the healthcare and specifically the healthcare analytics space. Where's the market going in terms of analytics?
I see a shift in analytics similar to what we're doing now. So at the moment, a large portion of the analytics is still only being leveraged by controllers or by members of the finance staff, and not being brought to the care process, the care side of the organizations. And we see that, well, if we're talking about the Netherlands, we see that more and more organizations are leveraging data by giving those insights to doctors and nurses and other practitioners. I think it's still a bit early on. If we look at the general picture, there are only a few organizations being the first movers, so to say, or early adapters. But I really think that leveraging data or analytics is becoming a more and more integrated into the caring process. What if there was someone or an application that would gather all the information and insights that's being written in research papers or other publications, and aggregates that, and as a doctor, when seeing a patient that has specific symptoms, you could just go online, go into an application, write down what it is, ask a few questions, send it into the analytics machine, and it would process it and scour through all those research papers, and then get back to the doctor or the GP and saying, well, we think it's this and this, and in 80% this treatment has created the bigger benefit for the patient, and in 70% this specific medication was most beneficial. So I really think that is the way to go short term, for sure, to leverage the analytics, that to leverage the analytics more on the treatment side. And in general, if you look at data, I think the usage of AI, and in particular, for example, image recognition, where not to repeat myself too often, but I think that's really the way to go. Just to I don't believe that a doctor can be replaced by a machine, because I think human interaction is one of the key components in the treatment process. But just helping those practitioners, helping those caretakers make better decisions based on data would improve the process and the treatment overall.
Oh yeah, totally. For, like you were saying, in the image recognition, those rote tasks where we know we can train AIs to be really, really good at this.
I really believe that.
Awesome. Yeah, I think that's a big focus of this conversation, has really been getting analytics and insights into the hands of medical practitioners to improve the lives of actual humans. I think that's a huge takeaway here. And so let's take a next step there. You talked a little bit about the trends in the space and how you also built your analytics solution into your software. How will we see analytics integrated into medical software in the future?
In my opinion, it will be, in the beginning, more and more a request that organizations will have when looking at medical software or buying it, or wanting to license it. I think at the moment it's not a key component in their search when doing a vendor selection, but I think it will be, in a couple of years, it will be one of the prime points that doctors do not have to write down the entire conversation, but with specific keywords, they could integrate data coming from different places into their notes. And like I mentioned before, I think that helping doctors with their decision-making process, with their treatment, would be really get a bigger role in the future. At GeriMedica, we're already trying to use analytics in our software, be it now with dashboard visualizations, but now we're also working at using an AI for our clients. So in the client portal, we just created an app. They can just talk to the app, and it will respond with whatever answer belongs to that question. So because our clients or the patients that are in our system are mostly elderly that are less mobile or are not as adept to mobiles as the youth among us. Yeah, or even have lesser eyesight because of the
Oh
aging
yeah,
process.
that's a huge factor. Yeah.
Yeah, if you can just, you don't have to type, you don't have to read, you can just talk to our application and our application talks back to you saying,
Yep.
well, next week you will have 3 appointments. Two of them are with a physical therapist, one is with the doctor. The doctor that will be seeing you is Dr. X. Here's a photo of Dr. X so you
Oh
can
wow.
recognize him. So, and that's all based on speech, and that's only on our client or patient
Yeah. 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 Yeah.
side. But on on our end user side, we're going to go even further, also using speech and also integrating AI to advise or give advice to doctors when they're writing down certain amounts of data in the record of a patient.
Yeah.
When certain keywords come up, our machine already starts, or the engine already starts rattling and yeah, gives certain feedback based on the age of the patient. Is it a male or female? What are the symptoms? And other variables. So we can really make sure that the doctors can make an informed decision, and
Yeah.
instead of only thinking and looking at other sources to confirm the symptoms or the treatment, they can really give more attention to the patient itself.
Right. Yeah, the system with the AI you're talking about, like this is an automated assistant kind of. It's like, hey, I already compiled all this research for you. I checked against what you're talking about. Looks like, it's, circumstance X, here's the treatment Y, and it should have outcome Z. And if it doesn't, I've got other options for you, and you can look into those as well.
Exactly. Yeah. I
That's
don't
so
know
cool.
if you don't, I don't know if you recognize this, Jack, but sometimes I also have to go to a GP, and
Hmm.
then you just sit in an office across a doctor behind the desk, and all you see is them typing in the computer and
Oh
typing,
yeah, yeah, yeah.
asking you questions, sometimes giving you eye contact, but most of the time they're just writing down or clicking because their system is so outdated or
Yeah.
so, it's such a burden. And what you want is that they stop looking at the computer and just keep looking at you,
Yeah, man.
and give you the attention that you deserve. And
Absolutely.
for that to happen, the software that those GPs or doctors or whatnot are using
Yep.
needs to be on a much higher level than it is now. And I think
100% agree.
yeah, and I think integrating analytics or the data or AI, like what we discussed before, is gonna make that happen.
Awesome. Yeah, it sounds like it's a thing that they don't even realize that they need or realize what a big impact it could make to their lives until, they're going to start seeing their colleagues get it, or they're going to be at a conference or something and they're going to hear about, oh yeah, I've got this new thing. It really helps me aggregate a bunch of this data and give me all these insights really quickly. And they'll say, well, I want that. And then they'll start looking, like you were saying, I think you really hit the nail on the head. They don't know that they're missing it, but it is going to start to become this decision-making factor when they're getting medical record software and looking for something that doesn't just fill that need as like, here, just write down some information, stick it in a file. It's like, no, help us learn from that information and improve quality of care.
Exactly. It's all about making the digital more human, more personal.
Absolutely. Awesome. And I think honestly, we live in a weird age where I feel like everything I write, I always include a line about how fast data is growing and about how we need new solutions to really handle that. And we talked about that earlier about just how there's so much medical data. It's just constantly more and more of it getting produced every day. But if we don't figure out a way to make those insights accessible to humans, it's worthless. It's a distraction.
Exactly. Yeah.
All right. Well, I think we got a lot of great stuff here. Any final thoughts on the future of the healthcare analytics or the things our listeners should keep in mind about the industry when building their own analytics solutions or thinking about it or just final thoughts?
Yeah, sure. So for the listeners that are building their own analytics solutions, I think a best practice, what I've learned is talk to your end users, talk to your clients, and really follow up on what they want and what they need. specifically what they need, because what they want is not always what they need. And just keep asking the tough questions and really follow through to the bottom line. And I think it's quality over quantity, which is most important. And I think if we look at the future of healthcare analytics, I don't want to repeat myself, but I think you
go ahead.
Summarized it very well, Jack, in your last sentence. It's just we need to make sure that all the digital things that are happening, that we make sure that it's being, would you say, that implemented well enough within the end users. Because in the end, it's all about helping those end users create a better experience, create a better process, improve the treatment of care, improve the care given. And I think that is in healthcare what it's all about. It's all about making sure that the patient that you're seeing or that is using the healthcare is being treated to the best possible way. And I think that is where something that we need to focus on when building, on the one hand, an analytics solution, but also building something else when focusing on healthcare.
Yeah, I'm 100% in agreement. I think that's a really hopeful note to end on. Again, empowering humans to help other humans. And I really want to thank you. I really want to thank you again for your time and your insights. This has been really interesting, far-ranging conversation. And thanks again for being on the podcast.
Great, no problem. Thank you for having me, Jack.
All right, take care, everybody. Check out the previous stuff we have from Hamza and build boldly, everybody. Take care.